Hello, my name is Frankie Keatsman, and I am a special education teacher at Lawrence High School. Today I wanted to spend time telling you about fetal alcohol syndrome. It's important as educators, as well as parents or future parents, to know more about FAS. It's through education that we can try to prevent future cases of FAS as well as intervene for students who are currently diagnosed. This presentation will spend time looking at the prevalence of the disability as well as risk factors for women for having a child with FAS. From there, we'll examine characteristics of the disability, looking especially at physical, behavioral, and academic challenges. From there, we'll look at interventions for both the classroom and for home so that parents and educators can work together to help students with FAS. Throughout this presentation, we'll spend time looking at your child or student's development throughout their lifespan. After the presentation, resources and references will be provided for you to use. In this slideshow, we will be examining the characteristics of fetal alcohol syndrome, identifying teaching strategies for home and school that can help students with FAS, and looking at FAS across a lifespan. When examining the prevalence of FAS, 1 in every 100 babies born have fetal alcohol syndrome, nearly the same rate as autism. FAS is more prevalent than Down syndrome, cerebral palsy, SIDS, cystic fibrosis, and spina bifida combined. What's even more heartbreaking is that FAS is 100% preventable. An estimated 40,000 newborns each year are affected by FAS. There is only one known cause of fetal alcohol syndrome, which is drinking during pregnancy. The most severe problems happen when drinking during the first trimester, since the brain is just beginning. But the second and third trimesters are still unsafe to drink as well. It is because of this that the U.S. Surgeon General has recommended for over 25 years that women not consume alcohol if they are pregnant or are planning to become pregnant. The big debate is, how much is okay to drink when you're pregnant? There are plenty of people that say you can drink 1 glass of wine and it'll have no problems at all. And there are even some research that shows that low to moderate drinking shows no negative effects. A 2012 Danish study reported that low, being 1 to 4 drinks per week, to moderate, being 5 to 8 drinks per week, showed no impact on a child's academic performance later in life. Heavy drinking did show negative side effects. However, there are just as many studies that show that any amount of drinking is harmful. The 2011 Alcohol Research and Health study showed that drinking low to moderate amounts while pregnant is associated with miscarriage, stillbirth, preterm delivery, and sudden infant death syndrome, or SIDS. The risks outweigh the benefits in any scenario. FAS is sometimes known as a hidden disability. This is because oftentimes it is not diagnosed until adolescence or adulthood, if at all. If it is identified early, interventions can minimize the impact and prevent secondary disabilities. The criteria for diagnosis includes documentation of all 3 facial abnormalities. This includes a smooth vertical groove between the upper lip and nose, thin border between the lip and adjacent normal skin, and small space between the corners and eye openings. The child must also have documentation of growth deficits and documentation of central nervous system abnormalities, including structural, neurological, functional, or a combination. This diagram gives a visual of the facial characteristics typical in cases of FAS. It clearly illustrates the smooth vertical groove between the upper lip and nose, the thin border between the lip and adjacent normal skin, and the small space between the corners of the eye openings. Again, some of these traits may not be pronounced until the individual is an adolescent. By being aware of these traits, we can help in recognizing a potential disability. The neurological characteristics of an individual with FAS include impaired cognitive functioning, which specifically impacts global intellect, executive functioning, learning, memory, and visual spatial reasoning. It also impairs self-regulation, which includes mood or behavior, attention, and impulse control. Finally, the individual can also have impairments in adaptive functioning, which includes language, social communication and interaction, daily living skills, and motor skills, both fine and gross motor. In addition to having neurological characteristics affected because of FAS, there are also medical implications. 20 to 50% of children with FAS also suffer from heart defects, epilepsy, cerebral palsy, kidney damage, cleft lip or palate, or heart disease. These can be any combination or alone, or may not be evident in that child. Unfortunately, there are no treatment or cures for fetal alcohol syndrome. However, there may be pharmaceutical drugs for some of the side effects related to FAS. As a parent raising an infant with FAS, there are certain implications that are important to be aware of. The infant oftentimes exhibits a poor wake cycle, which results in irritability. Something that you can do to help that infant would be to play soft music, rock the baby, frequently hold the child, and have low lights. The child may also exhibit a low birth weight. It would be important to consult a nutritionist to help adjust their weight. The child may also show delays in rolling over, crawling, or walking. This would be something to consult an occupational therapist for further help. The child may also show delays in speech. By consulting a speech-language pathologist, they can help give you further guidance specific to your child. Something you can do at home would be to purchase toys specifically designed for infants with delays. Finally, infants with FAS also have an increased rate of ear infections. Speaking to a specialist about evaluating the child's hearing and effectively treating infections can help prevent future cases. Some of the implications from when the child was an infant may carry over to when they are also a toddler. When they become a toddler, there are new implications that can become apparent for your child. To help with these things, establishing a routine with structure can help improve the child's focus. You can also simplify your room arrangement and reduce noise stimulation. Continuing to work with specialists and therapists will be key in helping their future development. An individual with FAS will need support throughout their entire lifespan. This support will come in 3 settings: in home life, the school setting, and out in the community. At home, it is important for parents to establish clear routines and expectations for behavior. Medication may be something to be considered depending on the side effects of the child's disability. Oftentimes, medication for anxiety, depression, or attention could be helpful. Playing quiet music may be helpful if your child is struggling with sleep disturbances and to aid in reducing tantrum-like behavior. At school, having a structured environment with clear expectations and routines will build on what they're already doing at home. Planning proactive interventions rather than reacting to misbehaviors will help build a positive environment for that child. Allowing for frequent breaks will help reduce frustrational levels for that student in the classroom and help them to feel successful. Additionally, shortened tasks will also help the child feel successful in completing their work. The most important, in my mind, is building community supports. This is for their postgraduate life to help them have a successful life after high school. This means building relationships. That can be with their doctors, their dentists, anyone to help them feel included in the community. Family counseling may be something worth considered not just for the individual with FAS, but for their entire family. Continuing to work with specialists throughout their lifespan may be important in helping continuing to build skills and relationships in the community. Getting involved in social clubs or groups can help reduce depression-like symptoms and help them to feel welcome within the community where they are living. When the child with FAS reaches that school age, it is critical to help the child to build and maintain friendships. Something that may be useful to consider would be pairing the child with a child who is slightly younger. If the child is struggling to sleep at night, reducing or eliminating naps can help them to have better sleep cycles, as well as helping with their attention span and their focus. Medication may be something considered for attention issues or depression. Continuing to work with therapists may help improve their fine and gross motor abilities. In general, these behavioral interventions throughout a lifetime will benefit those with FAS. Of course, every person may have different needs, but this is a good starting place to build successful life in home and school settings, and then to help that person to be an integral part of the community. At home and school, the more we can be a consistent team, the better the outcome for the student. We can do this by establishing consistent routines, recognizing positive behaviors. Positive behavioral supports are more effective than using punishment measures. Setting clear expectations for the students' behaviors, academics, and life skills. Limiting directions to one-step directions instead of multiple step can help make sure that what you're wanting will be carried out. Finally, the use of reminders. Because memory is something that is difficult for those with FAS, using visual reminders, written cues, and any other measures to help make sure that the work gets carried out will help that child to feel successful. When the child reaches adolescence, there are new implications that can come up. Impulse control is still related to attention and focus and may be aided by medication. Distinguishing between private and public behaviors will be a new challenge, and something that could help with that would be encouraging the child to participate in sports, clubs, or other structured activities to continue with socialization. The other students in these groups may also serve as good role models for the student on how to act. As the child with FAS reaches adulthood, there are new challenges that they will face, particularly regarding housing, transportation, employment, and money handling. Finding appropriate housing is very difficult. You should contact your state's Department of Disabilities to pursue residential funding and get on a waiting list for housing options. Many adults with FAS will need the family to handle financial matters throughout their lifespan. Finding an appropriate means of transportation will vary individual by individual, as well as employment. Continuing to be involved in the community in a structured setting would be the most beneficial when seeking employment opportunities for these individuals. Once the child is past adulthood and into their geriatric stage of life, there is no uniform statistic for their life expectancy. This is due to the varying degrees of the impact of FAS. Because of this, there is no clear statistic. Typically, lifespan is affected by medically related side effects as a result of the disorder. Because of this, the range may be from the age of 6 well into 50s. In conclusion, the effects of FAS will last for that person's lifetime and may be a constant challenge for not only them, but their families as well. These children with FAS suffer from cognitive difficulties. 85% of them will have facial deformities, 20 to 50% will suffer from medical or physical issues, 50% may display sexual misbehavior, and 95% will have medical disorders. FAS is 100% preventable. So while research may be on both sides of the drinking while pregnant argument, the risks clearly outweigh the benefits. Together, let's build awareness and prevent future cases of fetal alcohol syndrome.